They have no brakes on their control. They're out of control. So I get that all into control before I recommend that you introduce hormones so that we know that we have more of a regulatory system. So that's what we're trying to do in this course. But, different doctors have different opinions. So Dr. Brownstein, if they get the oncologist okay, because the patient says, I can't deal with this joint pain, I can't deal with this brain fog and fatigue, I want to be on hormones. And then if they go on hormones, he gives everyone just hormones out of the chute, all of them. So he doesn't have that same perspective that I do. He still gives all those other things at the same time. I'll want to, before I recommend that the patient talk to their team about getting hormones, I'll want to have them cross off the list all the things that make the estrogen sisters and brothers work more in harmony. So we've all got our own little opinion, and we present it in the conference as our different opinions, and we let the provider decide for themselves. So we do a deep dive in the labs, looking at what can we see in the labs where we can see that this is off that you did. So let me give you a case report. Uncontrolled inflammation is either the result of cancer or drives cancer. And you got to figure out if that person has inflammation. And that's not part of the regular oncologic approach. A surgeon came to me. She was a young woman. She had a son who was 1 year old, and she just wanted to go on hormones and wanted to really have me take an in-depth look at her and suggest to her what kind of hormones she might use. So I run this entire panel looking at all these inflammatory markers and a variety of other things that give us hints that things are growth out of control. And she had a really high inflammatory marker, a high sensitivity C-reactive protein that was almost 7. Did she have anything else? No.
Everything else was fine except the CRP.
We went ahead and ran a PET scan, and she had stage 4 breast cancer already to her bones. And that was the only marker.
Wouldn't you think that there would be more markers out there suggesting breast cancer?
Cancer is the silent disease. That is the deal. Cancer is the silent disease. And you cannot be diagnosed with advanced colorectal cancer till a few weeks before you're ready to exit this incarnation. It is the silent disease. That's part of the deal. This was 6 years ago, and she ended up going to an integrative cancer clinic in Los Angeles with Dr. Keneally, and she went into remission for 4 years. But I just saw her a month and a half ago because it's back with a vengeance, and I hadn't seen her for a big length of time, and now she's really struggling. You need to look at inflammatory markers is the point of that story, but that's not mainstream medicine. And you want to have a little peep show into your body. Am I growing a cancer that nobody knows about because it's a silent disease? Or if I do have cancer, what do I do to stay safe and not get it back again? That's a sane brain thinking those things. But testosterone is the major, it tamps down inflammation and it reboots estrogen receptor beta. So it's metabolized into dehydrotestosterone and 3-beta-diol. And these two metabolites are incredible breast protectors. Now, progesterone helps balance the signals of estrogen. And some of the doctors in our course will give all of the hormones out of the chute. I tend to do them once at a time to see how the patient is responding. Like if she started having one breast that was enlarging, I would want to be on top of that and have things that I could do to understand what was going on. I do a stair-step manner. It's a little different, but I've also had cancer twice, and I've done a lot of work on my own self, but that I've dove into the literature, and everybody told me all along, and they still do, you look better than any breast cancer patient. My surgeon, who I love to go to because her hands are so, they have educated fingers, and they feel a breast, and then they go and have surgery and see what's inside there. So they've got the most educated fingers of all. For years, I would go to breast cancer surgeons every year to get palpation because the form of cancer I had never showed up on mammogram. It never shows up on mammogram, the one I had. And in fact, the story...
So how did you detect it if you didn't do a mammogram?
We all should know our breast tissue intimately. And I had a mammogram, and it was totally normal. I was in my early 40s. A month later in the shower, which we all should regularly with soap, feel our own breasts. We're the best people to really find something in our breast tissue. And I felt a lump, and I just had a knowing. I've been a yoga teacher and a meditator for many years, and so I've kind of buffed that connection between my intuition and my soul and my spirit and my body, and I just had an ominous feeling about it. So I went over to my gynecologist, and I said to her, I'd like to get a biopsy. And I read the pros and cons of biopsy, but I wanted to get a biopsy. And she goes, I'm going away on a 6-week vacation, and you just had a mammogram. And the mammogram was normal. Forget it. And I said, I don't feel good about about this. I want to move forward. So right the day before she went on her vacation, she did a biopsy and it came back inconclusive. And I didn't want to wait. While she was on vacation, I had a friend that was a cardiologist and that we used to dance together a lot. And I said, can you get me a surgeon? I want this out. I want this out ASAP. And he got a surgeon friend of his who wasn't even a breast cancer surgeon. This is 31 years ago. Nobody knew anything about anything. And he removed this, whatever it was. And I woke up when you're still in the outpatient surgical center. And he goes, it's cancer. I was diagnosed with pure mucinous. It's a rare form. It tends to be a better player if your lymph nodes aren't involved. But nobody else had ever had a diagnosis of pure. Was mixed with other types of cancer, but nobody in the United States ever had a pure mucinous carcinoma before.
You're so unique, you're one of a kind.
And they wanted to treat me the way they treat everybody. And I thought, well, I don't know if the way they treat everybody is the right treatment for me because they've never treated this before. So I just started diving into the literature. And I found 2 studies out of Finland with this one primary investigator, Tolkinen. And I kept trying to call them up to say, how do you treat pure mucinous? Is it any different the way you treat others? I couldn't get a hold of them. I'd have to call 2, 3 in the morning and this and that. My radiologist was the wife of my oncologist. They were a team, well-intentioned. And I went to the radiology center and I was there getting fluoroscopy to put the grid lines on my chest to get ready for radiation. And there really is an angel. I was meant to do this path. So she got called out of the room. It got disrupted. I had to wait on the table in my gown. The radiologist got called out of the room and my phone rang on the chair. And I jump off the table and pick up the phone and it's the primary author of these 2 papers. Really, we didn't have papers in the United States until 2-3 years later after that. He calls me up. I say, yes. I said, I'm in the radiology center right now getting radiation, about to get radiation. And he goes, in the Nordic countries, this type of breast cancer, it's contraindicated to get radiation because it doesn't ever show up on mammogram. And if you get radiation, it'll create fibrosis, which is adverse tissue remodeling in your breast, and you won't be able to feel if it returns. So all of Finland, no woman with pure mucinous is allowed. Our standard of care in Finland is no radiation. So my radiologist walks into the room and I'm on the phone with this guy in Finland. And I say to her, I'm putting on my clothes. I'm leaving. I'm exit stage left. And she goes, what's going on? What's going on? And I go, well, I'm talking to this primary investigator. And she looks at me and I kid you not. And this is the real center, the seed of why I'm doing all of this. She looks at me and she goes, I don't care what, and she uses the whole word with the F word. I don't care what some effing dude in Finland says. And she sticks her finger in my nose. And I've got my hand on the phone with this guy in Finland. She goes, if you don't do radiation, you're going to effing die. And she sticks her finger in my nose and she repeats it like it's a prophecy 3 times. And in one fell swoop, I realized the cement of standard of care where her and her husband never saw a case of pure mucinous ever. And here I'm on the phone with somebody who had one study with 45 women and one study, something like 81 women. And they say standard of care in Finland is no radiation. And she was dictating to me, throwing bones at me that I was going to die if I didn't do what she said. And I knew then and there that this is the problem with standard of care, which is supposed to help patients, but it can block care when new information comes out. Do you know that in the United States today, I've really researched this. If you get a diagnosis of pure mucinous, you're still given radiation.
You're kidding me.
No,
I'm not. There must be more research since that two studies that you found. Since
moving information in the clinical trenches is like the Titanic moving away from the iceberg. So that's why I'm putting on this course. I hope the police don't show up at my door because nobody likes people that are disruptive, especially in cancer care. It's a scary realm. There's a lot of information to help people move through their experience with a higher quality of life and hopefully better survival outcomes. For example, I get women every day that their oncologist says you can't eat soy. It's estrogenic and it's going to worsen you.
Yeah. Your book, they haven't read your book. They don't know about William Lee. They don't know.
If you consume soy, you reduce your recurrence rate and you improve your mortality. And there's no debate. It's the most studied food that we have. It's a unique isoflavone and it signals just like testosterone. It is a food testosterone and it's really incredible. And you know then that you have a cancer cancer doctor who hasn't read any of the literature. So how do you believe anything that they say? But you still need the best of both worlds. So it's a confusing time, but that's the way that it is. And we're trying to kind of give some clarity to the confusion.